Hello, my name is Andra Blomkalns. I'm from the Stanford University School of Medicine, and I'll be presenting the abstract, Wellness in Academic Emergency Medicine, Initial Exploration of the 2019 Survey of the SAEM Physician Membership. I wanted to thank my co-authors for their contribution to this important work and to also thank the program committee for selecting this abstract. I have no relevant disclosures. For background and aims, we know that wellness is a large problem within healthcare providers, particularly in emergency medicine. Wellness within academic emergency medicine is not well known or understood. We sought to survey the emergency medicine trainees and faculty using a standardized testing instrument. The SAEM Wellness Committee evaluated and then added additional questions pertinent to the academic environment. The survey we used was the Stanford Physician Wellness Survey, originally developed by Tate Shanafelt and colleagues, and has been used on an annual basis for the Stanford faculty. The survey is comprised of approximately 20 domains, and each of those domains has between 4 and 8 questions. Domains may include professional fulfillment, burnout, interactions with the EHR, self-compassion, gratitude, and expectations of the working environment. There are 2 significant indices for discussion in this survey. One is professional fulfillment, and the other one is burnout. These are calculated and have been previously validated based on specific questions throughout the survey. So for most of our data, we will describe either professional fulfillment or burnout as an outcome. We hypothesized that professional fulfillment and burnout would differ in academic emergency medicine from that of previous studies in overall emergency medicine provider populations. Of a possible 5,771 respondents, 1,046 participated, which is 18% of that population. 43% were female and 23% were non-white. When breaking up the data by rank, we had representation from residents, fellows and assistant professors, associate professors, and then full professors as shown. In regard to residents, we're here looking at 2 distinctions between professional fulfillment and burnout, both by gender and by race. And whereas previous studies have demonstrated significant differences in professional fulfillment and burnout between these categories, we saw no differences in professional fulfillment and burnout between genders or race ethnicity. We found similar observations when conducting the same analysis with faculty. We found no difference in professional fulfillment and burnout between genders and race ethnicity. We then sought to examine specific academic questions that were entered by the Wellness Committee. The first one was for residents only, and that included, residency training is what I expected. And we can see that for each Likert scale point increase, that there was a significantly higher odds ratio professional fulfillment for residents. This one is for residents and faculty and discusses change in career. The specific question was, I have seriously considered pursuing a job outside of clinical medicine. Both residents and faculty showed an increased odds of burnout for each Likert point scale increase in their response. For this question, also pertaining to residents and faculty, working when sick, the question was, I regularly work clinical shifts when I am sick. This was associated with an increased odds of burnout for both residents and faculty, but no difference between residents and faculty. The next question is, the field of emergency medicine is what I expected. And this is showing the odds of professional fulfillment. And we can see that both in residents and faculty, the odds of professional fulfillment are higher with that response. However, once again, we notice that there are no differences between residents and faculty. This next slide examines rank and gender between professional fulfillment and burnout. We've divided the population by resident, junior attendings, which includes assistant professors and fellows, associate professors, and then full professors. Males are represented in gray, females are represented in red. And while we can see here that in general a trend exists that males report higher professional fulfillment and burnout, there are no differences among these groups for both rank and gender for both professional fulfillment and burnout. The closest one may be the one that draws your eye as professor in terms of professional fulfillment, where it appears as though males significantly are increased over females. However, the low number of respondents within the female professor category, a total of only 18, makes that a non-significant value. A few other faculty observations regarding specific academic questions. For each Likert scale point increase in seriously considering a job outside of the academic environment was associated with a lower odds of high professional fulfillment. Likewise, each Likert scale point increase in I have a clear understanding of the promotion process was associated with a 68% higher odds of professional fulfillment. In conclusion, emergency medicine providers and trainees are at a high risk of burnout. Previously shown differences in rank and gender are not apparent in this cohort. Likewise, previously shown differences in race and ethnicity are not apparent in this cohort. Lastly, meeting expectations of residency training in the field of emergency medicine was associated with significantly higher professional fulfillment. As for limitations, the survey study faculty represented a single society membership, which may have self-selected to be in academics. Academic questions that were added by the Wellness Committee were evaluated but have not been validated. There was somewhat limited survey participation of 18%. Next steps will include exploration of an academic wellness index similar to professional fulfillment and burnout, and further exploration of specific subgroups for themes. Thank you very much.